shall start as we are on time, and of course people who are joining can keep joining, and yeah, we'll have more people by the time. So hello everyone, and welcome you all to our session today, which will be focused about advocating for global health while at home, to give guidance for trainees and young activists on how they can be effective advocates for global health. How you must have noticed the past years, most of us have spent more time at home, and it is indeed an urgent issue for us to get engaged more on global health at home. So as CUGH Training Advisory Committee, we decided to base this session on this topic. So we'll be moderating this session today. I am Saad Wakas from Morocco, a member of the Trainee Advisory Committee of the CUGH. And yeah, before starting this session, I'll give the floor to Rinki, with me in the Trainee Advisory Committee, the chair of, who took the lead in preparing this session, to say some welcoming words.
Hello, everyone. Thank you so much for coming to this session today. As Saad mentioned, this year has been very much spent at home. So I think it's important that we understand our role as trainees and advocates and how we can improve the role of global health, even if we're not able to travel abroad. I want to take 1 second to thank CUGH, the TAC leadership, and all of our wonderful speakers today for taking the time to do this and going on. Trying to plan a virtual conference is definitely a new type of challenge, so I appreciate everyone's very hard work this year. And I will turn it back over to Saad so he can start the show.
Thank you very much, Rinki, and thank you for your amazing leadership. So again, we will be starting our interventions. We have a really amazing panel of inspirational speakers today. Most of interventions are pre-recorded, and I will be playing them. And we will have an interactive part, which is the second part. So make sure to keep an eye and collect or gather your questions while we will have all the speakers with us today for the interactive questions and answers part. So with that, I'll be sharing my screen, and our first speaker will be talking to us or introducing us about of the concept of global health and the challenging colonial views and newer approaches to global health. We will have Professor Prasad, who has more than 3 decades of work in underserved areas. And Prof. Prasad is Carlson Chair of Global Health and Executive Director of the Center of Global Health and Social Responsibility in the University of Minnesota. So I will be presenting his intervention.
Hi, folks. My name is Shali Prasad. I'm from the University of Minnesota. And I'm here to lead off this session to talk a little bit of the ethical framework of understanding global health. The point here is to look at some of these principles before we start doing advocacy for global health. Dr. Virginia Rawton follows me, and she will give you a framework of the history of global health. How did we get here? And I think those are important considerations for us to have before we go full-fledged into advocacy. And one of the main reasons this is important is the conversation about ethical frameworks of global health starts with a help-based premise, as in folks somewhere else do not have a particular thing. In this case, it would be clinical care or something else related to health, and we can provide that. So going over there to help them is the best approach we could take in furthering global health issues. The follow-up question for something like that is always, is hoping to help enough? Is there a potential that it can cause more problems? And here, I'd like to give you a personal anecdote. Many years ago, I used to work amongst forest tribes in India. And I remember the time it took for us to convince them about taking tuberculosis medications. And some of you here might know that tuberculosis medication need to be taken for a long period of time. But there were medical missions that were dropping in, parachuting in for a week at a time. And they convinced the folks that we've been working with for months to not take the medicine because they were concerned about side effects. And all the effort we had put in convincing the community to take antitubercular medication was wiped out. So I remember saying this at a conference, I hate medical missions. So if you look at medical missions as a framing activity within global health, well, then maybe global health is not the way to go, right? So let's then look at what are the ethical principles. Now, keep in mind, I'm not here to go into great detail about the ethics of global health. And a dear friend and bioethicist once told me that a framework, ethics is rather a framework that reasonable people can disagree upon. So let's keep that in mind too. The traditional way we have approached biomedical ethics, particularly in the US, is in the classical bioethical paradigm. And there are four main principles: autonomy of the person seeking care so that they can decide what's right for them; beneficence, as in the treatment provided is beneficial to the person; non-maleficence, as in the person giving the treatment is acting without malice, and that the treatment itself is based on that, and that there is a principle of justice. And yes, I have simplified this real quickly. But one of the important considerations in this is almost always my follow-up question, is that enough? Is a classical biomedical ethical framework, which we use in clinical care in the US quite often, is that enough when we consider global health issues? Particularly because there is more to global health than just clinical care. And here I'd like to step back a second to look at what is the premise of global health these days. And I won't go into great details about the history, Dr. Rawthorne will. I would like us to remember this particular definition of global health, which is the one that is used most often these days and which is the one that I like the most. It was by Copeland and others. And the two important phrases here, two important phrases that I have found important in guiding my work is improving health and achieving health equity. Now, think about those two phrases very carefully, because achieving health equity is something we don't do very well in this country. So how, when I say this country, I'm talking about the US, how can we now export our paradigms elsewhere when we have not done a good job in the US? The second part that is very important to consider is that quite often we recognize that clinical care is about 10% at best. It contributes to about 10% of the overall health of a person or a community. Now, that's a very small, very critical, don't get me wrong, I'm primarily trained as a clinician. It's a very critical but small part of the overall health of a person or a community. The rest of it are factors way beyond those clinical care. And a significant amount of global health activities still harp on the 10%, the clinical part. It's almost like saying that we are experts in putting Band-Aids, right? Why aren't we looking at the rest of it? The socioeconomic factors are probably the bigger factors. Health behaviors are significantly more important sometimes. Physical environment are things that we should be looking at. Now, if all of those should be the conversation in global health, why are we almost always narrowing our focus to clinical care? So I like this framework from development ethics. The field of development ethics is probably far ahead of global health ethics. These questions have been asked a few decades ago. And Dennis Goulet, who did some of the seminal work in development ethics, asked these three framing questions. And of these, the first one is something that I hold dear, and I feel we need something similar to this in global health. What is the good life? And when I'm talking about development, it's about building roads, building economic development and things like that. We still need to keep in mind, why are we doing this? A similar framing question is needed for global health. Now, without getting too esoteric, without getting too in the weeds of this, what I would suggest, however, as we are getting ready to be huge advocates for global health, is 3 framing questions that has guided my personal work. And feel free to use it any way you want. But I'd like to start with the first question, doing the right thing. While we are doing our activities in global health, that should be the bigger picture question. The second question, doing the thing right. And the third one, the right person doing it. And yes, these are not questions, these are statements, these are phrases. Sure, get it. You can phrase this as questions if you want. But if you look at these 3, the first one, doing the right thing, is more about the big picture question, the philosophical question, the ethical questions. The second one, doing the thing right, is more about science and methodology behind the work that we're doing. The third one, the right person doing, is partly about implementation, but partly acknowledging that sometimes we shouldn't be diving in. There are others who do it better than us. So hopefully these 3 phrases will form the basis of any of the discussion you're going to have as you advocate for global health. And as we move forward, hopefully we'll have better paradigms to wrestle with while we look towards working in a global environment, keeping in mind that health equity is something that all of us should be striving for. Thank you.
Thank you very much for Professor Prasad for this amazing introduction about the world of global health, about the really guiding questions. Are we the right person to doing the right thing and doing the things right? And we will be hearing more how we can implement those principles and guiding questions in our work in global health as trainees in the next with the next speakers. So thank you again, and moving on to the second speaker, Professor Virginia Rowton, who is board member of the Consortium of Universities of Global Health. She's also the Assistant Vice President for Global Engagement at the University of Maryland, Baltimore, and she will be speaking about how we can bring a global to local level. So it will be also another inspiring presentation. So I will leave you with the speaker right now. So I'll share my screen again.
Hi, everyone. I'm happy to be here today for the Trainee Advisory Committee session on global health advocacy at home. Thank you so much for inviting me, especially Rinki Goswani, who asked me to be here today, and share a little bit about the history of global health, as it's such an important component of being a good advocate. So I'd like to start with the early threads of what we now call global health. One early thread is the field of tropical medicine. And this field was when typically high-income country doctors and researchers left those countries to study medicine, particularly on behalf of the health of colonists, not community members in those settings. So in the 18th and 19th century, you saw researchers leave countries and go study malaria. This is a picture of Walter Reed, who was a US Army bacteriologist who went to Cuba to study yellow fever and learned that it was mosquitoes that transmitted yellow fever. Of course, Walter Reed now has his name on a hospital here near where I live in Bethesda, Maryland. And you can see from this picture that the very well-known global health school, the London School of Hygiene and Tropical Medicine, still bears this name, tropical medicine, in the name of the school. So this was an early thread. Next, we see another thread in which Western medicine and Western medical ideals were taken outside of high-income countries to low and middle-income countries, and that was through religious medical missions, primarily in the 19th century. And this was a time when Western medicine was given primacy and local forms of medicine were downgraded. Unfortunately, we still see the negative outcomes of that. And this is a picture of a medical missionary in a clinic in the 19th century. The next thread that we can trace for the history of global health is when countries first came together on matters of health. In 1851 in Paris, 12 countries got together and created what they called the International Sanitary Convention. And this was the start of a movement called international medicine. And these countries got together to discuss something that's very relevant to us today, which was how do we control epidemics and infectious disease now that international trade is picking up? And they put together guidelines for quarantine and they didn't call it then, but essentially social distancing, and discussed ways that they could work cooperatively on matters of health. The next important thread in the history of global health is after World War II and the creation of the United Nations and all the agencies that pledged to work together to support countries and promote world peace. The World Health Organization was created in 1946 to look at health-related issues, both healthcare delivery and research. And those were the topics that they took up on behalf of the United Nations. The first areas of interest for the World Health Organization were infectious diseases like malaria and tuberculosis, but they also took on the innovative field of looking particularly at women's and children's health and making that a priority. Another hallmark moment was the end of the Cold War and what is called the Alma-Ata Declaration. And Alma-Ata is in Kazakhstan, and it was a place where many countries gathered. This is a picture of those delegates gathering on the steps of the convention hall. And they urgently called on the countries of the world to address primary health care as the most important step to ensuring health care for all. And it called on high-income countries to devote resources to supporting low and middle-income countries develop their primary healthcare infrastructures. Then, of course, a huge moment in the history of global health is the advent of the HIV/AIDS pandemic. And this was a time when many countries worked together across the globe to address the pandemic, and the advent of big private organizations such as the Bill and Melinda Gates Foundation. This was a time when the US created the President's Emergency Plan for AIDS Relief. This was started by President George Bush, and you can see a picture of him here, and this is really one of the most positive legacies of his presidency. At that time, when many dollars were moving into the field of HIV/AIDS, into research and healthcare delivery, that is when a lot of global health programs started, particularly in the United States and Canada, with funds that supported global health research. And that's when academic programs for students primarily started at this time, between 1990 and 2020. And you see that by the vast growth of global health programs at schools and amount of global health research funds available. Now, I believe we're entering what we can call the decolonizing global health movement. And of course, the threads of this movement were present for a long time, for years, as people tried to dismantle the structures of colonialism that imbued every aspect of global health and international systems. But it's been particularly growing in the last year with the pandemic, with the rise of inquiry into systemic racism. And you start to see many universities around the world looking at how global health can be decolonized and what the elements of that are and what it looks like. And here are several graphics from programs around the world that are starting to look at how decolonizing global health should move forward. If I look at the different elements of the decolonizing global health movement, I see them in 5 different categories. The first is capacity building, which is to ensure that healthcare providers and researchers in low and middle income countries are developed and trained so that healthcare can be addressed at the community level and that research can be specifically targeted to community needs. Again, moving into the second bullet, that this focus on community engagement and community-based participatory research is obviously the most important pathway to ensuring that any research in healthcare delivery meets the needs of local communities and isn't imposed by outside institutions and organizations. A third theme in the decolonizing global health movement is equitable and mutually reciprocal partnerships. And that means that partnerships developed between high-income countries and low and middle-income countries must be based on principles of equity and be mutually beneficial to both sides of the partnership. 2 areas that I've been particularly interested in are ethical short-term experiences in global health. And these would be experiences such as medical externships, medical missions, global health electives that often take place outside of the United States and other high-income countries in low and middle-income countries. And I've looked at how they can be quite disruptive to the healthcare systems in low and middle-income countries. And in my expertise as a lawyer, I've looked at how some of these, not all, but some of these short-term experiences involve untrained students and others practicing medicine that they're not licensed to practice in the country where the mission or the experience takes place. And I hope if you want, you'll look at my article on Not Above the Law, which talks about this. I won't go into it deeply today, but this clip, this picture down at the bottom is a YouTube video called Lewis Does Brain Surgery. And in the video, you see a young man who is a high school student actually helping close a brain, a skull, and help, quotes around it, a brain surgery on a medical mission in Vietnam. And of course, it's so problematic in so many ways, not the least of which is the arrogance to think that this young person could come into an operating room with no training and participate in brain surgery. And so I've looked at this issue and hope to work with medical boards around the world to help them enforce their regulations, because in fact, every country that I've looked at has medical boards that license local healthcare providers. They do that to protect the health of people in their community. And often those rules are ignored. And that's an element of a colonial attitude that obviously needs to be dismantled. Finally, I've looked at the issue of, or the area of global to local or global learning. And this really has 2 definitions as I've studied it. The first, in the area of research and implementation science, is the global learning has been defined as the translation of interventions and programs developed outside the US for adoption and adaptation and implementation within US communities. So essentially, it's about looking for good ideas, good interventions, good public health ideas from outside the United States, and thinking about how they can best be translated to meet community needs in the United States. And that's an ongoing issue and project for many people, because we realize, and especially COVID-19 has taught us, that we could really use some good ideas, especially low-cost, high-impact health interventions in the United States. Finally, from an educational perspective, global learning, or global to local, has been defined as teaching a global perspective or understanding of transnational health issues, determinants, and solutions, and applying that perspective to address healthcare problems at the local US level. So many of you in your global health studies have likely taken a course which taught you a global perspective, for instance, the human rights framework or the social determinants of health, and you've applied that to issues in the United States to help give a different perspective and help you understand how that issue relates to similar issues throughout the world, and how, in a sense, we can learn from each other, and we need to have an orientation to learning from each other. So that is a brief history of global health, ending with the Decolonizing Global Health movement that's taking place right now, and which promises to really make the field as richly bilateral and community focused as it should be. And I look forward to any questions. Hi, everyone. I'm happy to be.
Indeed, thank you, Dr. Roten, for the amazing presentation. And it really reflected with me, personally coming from a low middle income country, Morocco, how focusing on the community itself and how collaborations and interactions are key to success of a global health program, and how important the decolonizing the global health is nowadays. So thank you again for taking us into a brief history of the global health movement and the issues that we are having today or witnessing today in our world. So after these brief presentations that we had, it's time to take more details and dive into more tools for us as trainees on how we really can do some real global health advocacy, especially at home. And we have some amazing speakers coming up from the University of California Center of Global Health, who will be sharing with us some amazing tools to succeed our advocacy, including reaching out to legislators, using of social media, writing of open work. So please keep an eye on the next presentation. And yeah, I'll share my screen right now.
Hi, I'm Sarah Lawrence, and I am with the UC Global Health Institute Advocacy Initiative. Thank you so much for joining us via Zoom today. So there's 4 of us presenting today, all from the Advocacy Initiative. Today we're going to talk about tools for effective advocacy. And I just want to preface this talk by saying that this is a pretty US-centric talk, because the way that our program developed, we were founded in 2017, and in the wake of political transition in the US that led to proposals to significantly cut US federal funding for global health. So the initiative grew into a pretty large group of over 30 very dedicated undergraduate, professional, and graduate students across the University of California who are engaging in a number of different forms of advocacy, including some of the things that we'll talk about today: publishing op-eds, leading a letter writing campaign, community engagement events, engaging in social media, and meeting directly with legislators. And so through that, we've learned a lot about kind of effective ways and less effective ways of advocating. We're going to kind of distill that information for you today into some key takeaway points for and tools for how to advocate, and leave you also with our advocacy toolkit at the end of the talk. But just so you know, some of these things would have to be adapted a little bit for the different contexts in which each of you are attempting to advocate for change. So as an overview, again, we'll talk just a brief introduction to each of us, and then I'll talk about op-eds, and then we'll move on to each of us will talk about a different topic: social media, meeting with legislators, and then how to introduce a bill. So back up one slide. So this is just all of us. We'll each introduce ourselves when we start our section. So I'm Sarah Lawrence again. I'm an internal medicine resident at the Mayo Clinic, and I was the former director of the CUGH Advocacy Initiative. So now we can talk about tips for writing an op-ed. So op-eds are really, first of all, I want to start with just saying there's a ton of great resources that are much more in depth and have, you can take a lot more time than what we have today to talk about these things. But one of the ones that I like the most is called the Op-Ed Project, and the link for them is there. But then moving on to just how to even start. It seems like a very kind of intimidating task to write an op-ed, but it's really not as difficult as you might think. So first you have to choose your topic, and always, 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 I can't stress this enough, your topic must be timely and it must be relevant. So you can't write about a bill that already passed because nobody's going to publish that unless it's something that's very controversial perhaps, and there is still a lot of discussion about it. But otherwise, if you're wanting to do an op-ed for the purpose of advocacy, it really needs to be something that you can still change and that is relevant. So you have to think ahead. So oftentimes, like in our US context here, you can think about bills that are kind of on the docket coming up, things that people want to hear about and want your opinion on. And then you have to think about who you are and what you bring to the table. So I'm a resident physician, so there's lots of things that as a resident physician that I could comment on and people would want to listen. For many of you, you work in different fields, engineering or whatever it may be, and you can kind of capitalize on what you bring to the table and write from that perspective. And that will make you more publishable and people will want to listen more. And then early on, I would encourage you to identify potential publishers and review their guidelines so that you can be prepared as you're writing for the length. Typically, op-eds are 500 to 800 words in length. And then they can be published in a lot of different mediums, university campus papers. You can start very local newspapers, city newspapers, websites, national papers, blogs, magazines. There's lots of places that publish op-eds. And generally you don't want to send your op-ed to more than one similar paper at a time. And oftentimes the reason to review those guidelines early is because, for instance, the New York Times only allows people to send your op-ed there, and it can't be sent anywhere else while they're being reviewed by the New York Times, and most large newspaper organizations are also like that. And then when you're actually sitting down to write your op-ed, think about your audience. So you definitely want to target a specific audience and not write too generally. Otherwise, it becomes less and less relevant. So definitely target a specific audience. Start by clearly stating your purpose. This should be a pretty succinct document. Again, it's only 500 to 800 words. So make it succinct, state your purpose clearly from the beginning. And then usually you want to kind of use a hook of some kind, something interesting in the beginning. You can read more about that on all of these, the op-ed projects and others. They talk a lot about the hook. And then end with an ask or a strong take-home point so that your audience is left with something to do. So specifically, we'll talk more also throughout our talk about the ask. It's relevant kind of in advocacy and almost any form of advocacy that you're doing. You definitely want to have an ask that somebody can do something with what you're, the information you're giving them. And then before you actually send it to any publisher, get lots of feedback, and ideally feedback from good writers for one, and then feedback from people within the audience, the target audience that you're trying to reach with your op-ed. So moving on to the next slide, this is just an example of my very first op-ed that I published. This was in the Spokesman Review. I'm originally from North Idaho. This is our regional newspaper based out of Spokane, Washington. And there was a resolution that was being passed at the time that was targeting, essentially in the end, was targeting Planned Parenthood and women's health funding. And so it was the only paper that I sent it to. It was published. I made it very personal. I talked about my story, me as a medical student at that time, and why what I said was relevant. And my sister allowed me to even interview her and put all of her information in there. So it was a very local, personal story. That's why it was picked up. And I'm still, I think this is the op-ed I'm most proud of, and I put a lot of work into it, turned it around quickly, made it timely, made it relevant, and it was published. So now I'll pass off to Jackie to talk about tips for advocacy through social media.
Thanks, Sarah. I'm Jackie. Currently, I'm doing research at Stanford, and I'm going to walk you through some tips for social media. So first and foremost, I just want to say that just having access to social media is a privilege in many countries around the world. As we know, internet suppression is very real. Access to VPN networks are very restricted. And so even having access to social media and being able to speak on social media under a democratically elected government is a privilege. And so we can use that to amplify voices of those in countries that don't get this privilege. I just want to point out that many, or actually most US Congress members post on social media accounts, and many of them have diversified their social media portfolios. The most common way to reach your congressional representative is through Twitter, as you can see here, but Instagram and YouTube are booming fields as well. And so I think we're going to see more interest in those social media platforms in the next decade. Using photo decks to inform and tell stories is a great way to advocate around certain issues that you are passionate about. If you are an expert in a certain field, or if you work for an organization that does great work in a specific area on a specific topic, it is a great way to generate more knowledge for other people to learn about the topics that you're advocating around. And so Canva is actually a great app for creating these aesthetically pleasing text posts so that you can educate people in a short 10 photo slide deck about the topics that you're interested in. I also want to point out that you can maximize your link in bio on Instagram or on Twitter or Facebook to link multiple action items. So some examples here are seen by the UNHCR and also the UN Women Instagram account. So there's two different formats you can go with. Both of these are very popular link aggregators, and they're very helpful if you have many action items that you want your followers to be aware of. So both of them are free. One of them is a bit more simple, and you can definitely modify the user interface to fit whatever you like. And for specifically Linktree, you can actually get basic analytics like link clicks so that you can identify what your followers are most interested in. I also want to point out that there's been a lot of great tools that have come out since the last presidential election in the US, actually. And one of the ones is ResistBot. The whole premise of ResistBot is to be able to contact your officials in under 2 minutes. And being someone that has actually used this tool, I can guarantee that it actually is under 2 minutes that you can send a petition, sign a petition, or create a petition. And so these are the steps that you would have to go through, but it's very simple. It basically just entails texting this one number, and then ResistBot will basically walk you through all the steps that you would need to start a petition or just send a letter to your representative. These are some examples of some petitions that have come out of ResistBot. I think it's really cool that after you create a petition by text, ResistBot will actually send you a photo of your petition so that you can share it to your social media. And in addition, it'll create a unique code so that any of your followers can send that 5-6 letter code to the ResistBot number 50409, and it'll immediately get them signed and sent to their local representative. I want to go over some tips for responsible social media use. Firstly, I think it's really important that we credit any sources of information or theoretical frameworks. A lot of theories are actually born out of people of color or women of color theorists, so it's really important that we credit that. Secondly, I want to say it's really important to be vulnerable on social media, even though it is very hard, and I am also learning this personally. It's okay to be open to being wrong. That way we can normalize learning and unlearning and be an example for learning. And I also want to say, kind of along those lines, that it's important to amplify any voices and stories that have been historically and structurally repressed. And so that involves sharing any content from primary sources, sharing content from people who are actually going through the struggles, And that will help, everyone be a little bit more mindful of their social media real estate. And lastly, I want to say that, we're very familiar with the social media aesthetics, and that there is oftentimes, information that isn't always accurate, but is presented in a very aesthetically pleasing way. And so we have to learn to not equate the two, but as advocates, it is important to leverage aesthetic to draw attention to content that we want to advocate around. It'll be a really helpful tip moving forward.
Thank you.
And now, go ahead, Betty.
Hi, my name is Betty Nguyen, and I'm a third-year medical student at UC Riverside School of Medicine. I'll be sharing some tips on meeting with legislators. So you're probably wondering, why should you reach out to your legislator? Well, it's been known to be one of the most powerful advocacy strategies. Legislators are people in Congress, such as the Senate or the House, who represent your district. So members of the Congress want to hear from their constituents. They want to hear from real people who live in their districts and who they represent. So one way you can reach out to your legislator is by calling or emailing them, and you can find their contact information on senate.gov or house.gov. When you reach out to these legislators, make sure to mention the topic of discussion that you'll be bringing forth. Okay, so before you step foot into that meeting room, make sure to do work and prepare beforehand. One of the most important things you should prepare is stories. So after meeting with these legislators and their staffers, what I realized is stories are what resonate with people the most, and they breathe life into proposed legislation or existing legislation. So do your work and make sure you figure out what kind of stories the people in the community have to tell about a certain topic or issue that you're proposing or bringing up. And gather these stories into 3 to 5 key points of discussion. So you don't want to overwhelm the staffer or the legislator with too many things in one short meeting. So just keep it short and concise and really focus on the stories and narrow everything down to about 3 to 5 main takeaway points. Before meeting with them, also make sure to look into facts about your region. So what is the average person like who is living in this district? What kind of people are being affected by this issue? And most importantly, also look into the background of the legislator themselves. For instance, how did they vote in the past on global health funding? Did they support it or did they reject it? And this information is vital because going into the meeting, you can kind of expect, okay, this is how they'll respond to certain things I'd say. If they're already for global health funding, then you'd want to bring some stories to the table that help them further their case. And if they were against global health funding, for instance, you'd want to find some common grounds and find some reasons why they should support global health funding. In these meetings, it's also important to talk about the constituents. So the people that they are representing, how many of them are affected by this issue or topic? The more people who are affected in that certain region or district, the more powerful your message will be. And also prepare some materials to leave behind, such as like a 1-page handout of summarizing everything that you're discussing. Okay, so during the meeting is a lot of fun. As you can see, this was Millie and I at Senator Kamala Harris's office back when she was not vice president yet. We had a lot of fun. She was not there, unfortunately, so we didn't get to meet her, but we met with one of her very nice staffers. So when you go to these meetings, make sure you dress the part. Keep track of time. They're all very busy, and sometimes they won't give you more than 5 or 10, maybe 15 minutes to meet with them. During the meeting, make sure to tell these personal stories that you've collected. Really, a lot of legislators are not scientists, so bringing just facts or bringing experiments or data won't really excite them the way that stories do, and stories specifically of how the constituents are being affected. Bring up the points of discussion, like I mentioned earlier, and end your meeting with an ask. And the ask is essentially the answer to the question, what do you want them to do. So for us, when we were advocating, we wanted our legislators to support global health funding. So in meetings with people who did not support global health funding, we brought up some reasons why it was important to the United States. And we left the ask with, please support global health funding. Okay, I'll pass it on to Millie.
Hi, everybody. My name is Millie. I am a current research associate for Cedars-Sinai Medical Center, and I'll be talking about the ask in greater detail, specifically in terms of influencing policy by introducing bills as a constituent. So, believe it or not, as a constituent, you do have the power to influence a bill that is in the process of being introduced and passed through Congress. You just have to be mindful of every step, which I'm going to walk through for these next few slides. So the left column, what your senators and representatives are going to be doing with the bill, and the right, what advocates themselves can do. So step one is drafting the bill. And you can start drafting a bill before you even meet with your legislator, just as Betty mentioned in the slides before. You can look at previous bills that were passed and use those kind of as a template for whatever ask you want. So if you're working with a community and you want a specific type of educational facility established or some type of global health specific program, you can start drafting this bill with other advocates that you're working with or grassroots organizations and bring that with you. And when the senator or the representative staff ask you, what would you like us to do? You can say, I would like for you to help me introduce this bill into Congress. So then step two would be introducing the bill. So you would need the senator or representative to co-sponsor the bill. So that would be the person that you met with. The whole point would be to ask them to help co-sponsor this bill that you would assist in the drafting process with. So Senate bills, just for a little terminology, they start with an S, and House of Representative bills start with an HR. It just kind of shows where they originated throughout the process. It's not really too large of a difference there. Before they introduce the bill, you as an advocate can work with them to discuss who can co-sponsor or who's potentially more likely to co-sponsor. And you can start brainstorming, starting to set up meetings with these elected officials and what other advocates and grassroots organizations can do, because the whole process, you need to be working with both the House and the Senate at the same time. So it's good to know who's on your side, essentially, and who isn't. So it's good to have a game plan of what you're going to do with the bill. So step three, the bill would be referred to committees and subcommittees. So once the bill is brought up by the senator or representative that co-sponsors it, the secretary of the Senate and or the clerk of the House of the Representatives will assign the bill to the proper committee. And then this committee will assign it to the proper subcommittee within the committee. And advocates can meet with these committees staffers or subcommittee staffers and discuss the bill and why it's critical to get more co-sponsors within these committees themselves. So it's important to be informed about the process that the bill is going to be going through. So then you know, okay, it's in this committee. These are the members that are part of the committee. These are their staffers. This is the person working in global health on their staff. Let's talk to them. So step four would be co-sponsoring the bill. So throughout the process, members of Congress can add their names as co-sponsors, which essentially means that they're a formal supporter of the bill. It's important to understand that this can only be done when Congress is in session, and committee chairmen and ranking leaders usually don't co-sponsor a bill because they hold a lot of power over the process of the committee itself. And you can issue action items as an advocate from grassroots organizations to be involved in the content of the bill and continually contact officials about what the process is and how things are moving forward. Step five would be a subcommittee hearing and what's called a markup. So the subcommittee may hold a hearing to discuss the bill. It is not guaranteed that the subcommittee will hold a hearing. So what you can do as an advocate is encourage why it's important to hold a hearing to further discuss this bill and then proceed to do the markup during the hearing. So when hearings are done, subcommittee will mark up the bill. Basically, line by line, they'll edit the bill and discuss what this subcommittee would like in the bill or what language they would like to see changed. And the subcommittee will then vote to send up this marked up bill to full committee. So on the side, advocates and grassroots groups can continue meeting with subcommittees, get an idea of what the markups are happening, and encourage the hearings in the process. They also can be involved in the hearing by, as I noted at the top right, they can testify themselves if that's what the subcommittee would like to hear, submit written statements to be included in the record. They can read it out loud in the subcommittee meeting or distribute informational materials that members can receive themselves. Step six, subcommittees will vote, send this over to full committee. Full committee may repeat everything that the subcommittee did or even choose specific steps to repeat themselves. And throughout this process, advocates will be doing the same thing in terms of making sure which members on full committee would be more likely to co-sponsor, less likely to co-sponsor, targeting your meetings and discussions in those directions. And then full committee will vote to send the report to full House or Senate. So if it originated with the representative introducing the bill, it would go to full House, and then vice versa for the Senate. Step 7 would be the floor consideration and chamber vote. So the leaders will determine debate parameters for the House or for the Senate, wherever it goes to, and the bill can be amended, voted up or down, referred back to committee, or tabled. If steps 3 or 4 happen, the bill basically is dead. It won't really move forward after that. So even if a bill makes it out of committee, it's very rarely brought to the floor. So it's important to keep tabs on what step your bill is in the process, and keep pushing for why it's important to get this formally into law, because things that are in law are less likely to be overturned super easily by another administration that were to come into play, whereas things done by executive order are very easily reversed by executive order by another administration that comes in. Step 8, the House or the Senate, whichever one, will vote to send that bill to the other chamber, which will then discuss the bill, and the advocates, again, would be meeting with potential co-sponsors within the other House. They'll find more people if they feel as if that's necessary. Next step would be conference committee. So the critical thing here is that Senate and House representatives must agree on the final form of the bill. So they basically put together a conference committee that consists of senators and representatives who discuss and debate the final text of the bill. If they can't agree on anything, the bill dies. So this is an important step where advocates keep track of what provisions are being added and what are being removed. And you need to figure out what is non-negotiable for you and what is negotiable for you. And if it's something that you are not willing to negotiate on, it's important to continue these meetings to push why this information is critical and bring out, stories and facts as for why this bill will not be effective unless it includes these provisions that you had. Step 10, if an agreement is reached in conference committee, the bill is now called a uniform measure. And this conference report is sent to the Senate and the House for a final vote. So after conference report is sent to a final vote, if you're not satisfied with conference report, then you can encourage an elected official to propose a motion to recommit, which basically kills the bill. And you can start over with the process or see what you can do from there with the information moving forward. Step 11 is the big step. If all those steps happen smoothly, it's sent to the president, you can sign it into law, and there's a couple other ways that it cannot be brought into law that I've listed here. And with number 4, importantly, if the president does happen to veto the bill, Congress can override the vote with a 2/3 vote in the House and a 2/3 vote in the Senate. You have to get both. If you don't get one or the other, the bill will die. So this is where advocates, if it goes back to the Congress to vote, you keep in mind, okay, who else can we, meet with in order to provide information on why it's important to support this bill? Maybe they didn't the first time, and you can explain why and work with the information you have there. So those are the steps of introducing a bill. It's long and it seems complicated, but it is accessible to constituents. And as we all have mentioned at some point, your elected officials are there to represent you and work for you. So you never feel as if you're intruding upon their time and their energy, because they're here to do the job that you sent them to government to do.
Great. Thanks so much, Millie. So I'm going to just end here with the Global Health Advocacy Guide. This is the toolkit that you can reach. You can find it on the UC Global Health Institute website at this link below, or you can just search UCGHI Advocacy Initiative Toolkit or Advocacy Guide, and you'll be able to pull it up that way as well. There's some other links down here also. The Advocacy Toolkit is really, really great. It's about 14 or 15 pages long of detailed information specifically on global health advocacy put together by our advocates within the program, and it's great. I love it. I'm very proud of it, and it's a really helpful tool and reference guide for you. And then lastly, last slide. So I think we'll end there. Thank you so much for listening to our presentation. And if you guys have any questions, on the last slide, there will be our email address. There they are. There are email addresses. You can reach out to each of us if you forget who we are. There's earlier in the presentation, we had our pictures as well and our names and short bios there. And feel free to email with any questions. And thanks so much for listening. We hope you enjoy the rest of the satellite sessions and the conference.
Thank you very much, Sarah, Jackie, Millie, and Betty for really sharing those very useful tools for all of us trainees to hopefully employ in our global health advocacy. And it's really inspiring, really, to see young people like yourselves getting engaged, working in global health advocacy and aiming for change. And yeah, thank you very much for sharing that. So before moving, we still have some inspirational talks, some success stories to share, some learning lessons. What I would like to ask you to do, we will do a little exerciser just to give some time for us to refresh and to grasp those information. You can feel free to activate your camera, or if not, you can just engage with us. So it will be just a little exercise and you can follow my steps. So what I would like to ask you is write your name in your screen like that using your fingers. So let's do that. Letter by letter. Okay. Now that you have done that, let's use our elbow to write our name. My name is pretty short, maybe a few minutes for seconds for the others to write. Okay, now let's try with our shoulder to write our name. I see some people struggling there, but keep it up. And finally, using two fingers to write our name. Perfect. Thank you very much for your engagement. And yeah, with that, we can move on to the next speaker, who is Professor Virginia Rothen, who is an the Assistant Vice President for Global Engagements in the University of Maryland, Baltimore, and Executive Director of the Center of Global Engagement. So she is, no apologies, we're moving to Professor Nushid Amiruddin. So Professor Amiruddin is Assistant Professor of Pediatrics in the Mayo Clinic and Chair of the Council on Communications and Media in the American Academy of Pediatrics. So Professor Amiruddin will be sharing some reflections and best practices, as well as challenges when it comes to global health advocacy. So I will be sharing my screen, and let's enjoy the presentation.
By saying that I have no by saying
let's try again.
Hello, I am Dr. Nusheen Aminuddin. I am a pediatrician at the Mayo Clinic in Rochester, Minnesota, and I am thrilled to be part of this group presentation. What I'll be talking about mostly today are successes and challenges in health advocacy with a global emphasis. I wanted to start out by saying that I have no disclosures. The only disclaimer is that some of the examples of advocacy that you'll see me cover are not necessarily the official positions of my affiliated organizations. You have heard the rest of the group from UC talk a little bit about examples of advocacy, and I just wanted to highlight a few additional types of advocacy that I've been involved in. The pictures I have are actually from social media, but a number of them reflect events or campaigns that were coordinated in communities and by organizations. For example, one of my colleagues, Dr. Kate Yoon, who is a pediatrician at the Children's Hospital of Philadelphia, found that it was a good way to raise awareness of World Refugee Day by using social media. Another one of my colleagues, Dr. Kim Mukherjee, who is a pediatrician in Louisiana, has a real gift for sharing patient stories, de-identified, of course, so it's HIPAA compliant, that really help humanize issues for people who may not have much contact with with people coming from other countries, refugees, immigrants, undocumented people. And another one of my colleagues, Dr. Beth Dawson-Hahn, was actually able to use her own family's story of her grandfather-in-law to really humanize the importance of refugees and the contributions that they bring to this country. I also find that when we look at children's literature and other literature in general, we can sometimes find some real gems that help explain situations, not just to children, but to people around them. And when it came to undocumented families and dreamers, especially when we were working to defend DACA, I thought that these particular books were really helpful. I also think that it can be really powerful when you look at examples of people who came to this country as refugees or whose parents came as refugees. And that helps reframe the narrative to one of shared humanity, and it really taps into the idea of shared prosperity, as we can all be part of this narrative and uplift people. And a few years ago, I was actually part of a local demonstration in our community when we were looking at the effects of the travel ban on predominantly Muslim. I also wanted to point out that even for topics that may seem political, those of us who are on the ground and who care for patients from a variety of countries who've come here under a variety of circumstances for many different reasons, it's actually important to know that sometimes you can have institutional support. The American Academy of Pediatrics, which has always been focused on helping children thrive and families thrive, had very well-organized campaigns to oppose the public charge rule that came up in the fall of 2018, and also was a leading voice for keeping families together when children were being separated at the U.S. southern border. So again, that was just a very, very quick overview of some of the advocacy campaigns that my colleagues and I have been part of. I wanted to dive a little bit deeper to talk about one particular success in health advocacy that we had. In the summer and fall of 2017, there were proposed cuts to Medicaid and Medicare. And as some of you may know, Medicaid, which is the governmental insurance program for low-income individuals, is actually the largest health insurer of children in the United States. And that includes both citizen children and immigrant children. And so when we heard that cuts were being proposed, we knew that this would be harmful to a number of our patients and could really affect not just their ability to access health services, but we know from research over the last few decades that health insurance and the ability to access healthcare is actually critical to a child's ability to graduate from high school, achieve higher education, and really help create not just health and wellness, but economic security for them. And so one of the things that the American Academy of Pediatrics organized was a campaign to keep kids covered. And the hashtag was one that was shared over social media, but the campaign itself was actually pretty wide-ranging and involved pediatricians calling elected officials, making sure that their voices were heard so that people would understand the really devastating effects of what seemed like an abstract and somewhat complicated policy issue. One of the things I did is, as part of this larger campaign, that I also want to make sure we understand was a grassroots campaign from all over the United States, from patient groups, from even hospital groups. Multiple people realized that this was going to be a difficult and harmful thing for them. And so really this was part of a much larger effort. But one of the things that I was involved in was getting pediatricians to share their own stories on camera. And for those of you who know, we're maybe not the most, I guess, the most camera ready, and I say that in a loving way. There are certainly people within our group who have become very effective public speakers and media speakers, but so many of the pediatricians whom I contacted were people who said, "You're never going to get me on camera. This is not my kind of thing." It's not just typically something you think of as part of being our skill set, but I have to say that because the issue was so critically important, I'm so grateful that we, over the course of the campaign, were able to collect over 200 pediatrician videos. And these were pediatricians who, again, got over their camera shyness because the issue was important enough. They told their own stories. They told their patient stories. They talked about the impact this would have in their communities for their patients, and the effect was tremendous. And again, even though this was part of a larger effort by the American Academy of Pediatrics, it was largely a grassroots effort from pediatricians who literally just put themselves on camera, some of them while they were working night shift, some of them in their homes, just wherever they could do it. And what was really lovely about this is that this grassroots effort caught the attention of some major news outlets like the New York Times, the Washington Post. There was even an anonymous donor who learned about it and was so moved by it that they wanted to make a more professional video. And so thanks to their donation, the American Academy of Pediatrics was able to create a compilation video of my colleagues and I speaking about this. And you can actually find that now on the American Academy of Pediatrics website under, I believe the title is America's Pediatricians Talk About How Medicaid Cuts Can Harm Their Patients. And so you can still find that from the summer of 2017. And as you probably know, again, this certainly wasn't just our effort, but massive nationwide effort, largely grassroots, that ultimately resulted in the Medicaid cuts not going through, which happened late at night, one night, for those of you who are C-SPAN watchers. So again, that was one of the big examples of successful health advocacy that we had. I also want to take a little bit of time to talk about challenges in advocacy. And even though we've called this challenges, it's really more about things to anticipate, I think, as you prepare to advocate in whatever forum feels best to you. So I think the most important thing is you just have to know what you might encounter. First and foremost, it's important to know the rules of engagement for your institution. Number two, it's important to expect and prepare for trolls, and I'll talk a little bit more about what that means. And then finally, how can you really make your message resonate outside your echo chamber? How can you cross over partisan or political lines to really help others understand why this is such an important issue? So most importantly, know your organization's rules. For example, I work at the Mayo Clinic, but as you heard in the beginning, I try to make it clear that what I'm talking about are my opinions only and not necessarily the institution's official position. Sometimes that means you need to add a disclaimer. But the caveat is that even if you have a disclaimer, very inflammatory speech or legal violations like HIPAA violations, plagiarism, or just ethical breaches are not going to be absolved by a disclaimer. So you always really have to maintain what I tend to think of as 24/7 professionalism whenever you're putting yourself out there as an advocate and speaking on important issues. So trolls, we tend to think of trolls as more of an online phenomenon, but truthfully, trolls can come from anywhere. And trolls are basically people who are, with not necessarily good intention, trying to ask questions to derail you or distract you, or to harass you. And this can unfortunately happen in real life and online. Two of my pediatrician colleagues, Dr. Rhea Boyd and Dr. Nicole Baldwin, in January, February of 2020, unfortunately both faced really terrible onslaughts for work they had done. Dr. Baldwin had made a pro-vaccination video that went viral on TikTok, and was really a lovely way to reach teenage patients directly. And Dr. Boyd had written a really important article about racism that was published in Lancet. And unfortunately, that was noticed by white supremacists. And so both of them actually had to get law enforcement involved for protection. And so I just say, unfortunately, that exists, but there are things that need to be said. And so make sure that you're protecting yourself, you're protecting your colleagues, but don't be afraid to say things that really need to be said so that your voice and your important points are not drowned out by bad information. And I just wanted to list a couple of troll control tips. Before you respond, in haste to anything, do a little bit of research. Sometimes it's best to just walk away and block people. Choose your battles wisely, but also know when to disengage. And more importantly, I think always remain professional. For better or for worse, we are generally held to a higher standard as health professionals. And remember that even if people are trying to upset you, you don't need to take the bait. So I want to talk a little bit about how to make your message resonate. I think the most important thing here is really know your target audience, but also think about how your message is universal and what you can do to help inform, illustrate your story and persuade others to understand what you're talking about. And one of the great resources that I've had the opportunity to work with are people at the Frameworks Institute. If you look them up online, they also have some classes and modules that you can access both for free and with pay, that talks about how reframing controversial or difficult political issues can actually help the way your message is taken. And again, just a couple of examples of that. They have online tools to reframe refugee policy discussions. I learned a lot from them. I had written a letter to the editor some years ago, and from that experience learned that just talking about facts do not really frame effectively. And unfortunately, we do live in a post-factual world. So the next time I wrote a letter to the editor, I tried to reframe it and point out similarities to really, again, cross out of my own echo chamber to make an issue resonate with people who may not have the same beliefs or political leanings that I do. I also think it's important when you reframe to humanize the message, and you might have noticed that theme throughout my presentation. And I was actually able to use my own story to help humanize the message of why WWII programs are important. And safety net programs do have evidence that they work. So in conclusion, I just want to say it may seem like there's a lot out there, but this is something where your voice is very much needed. Believe me, if I can do it, so can you. I'm happy to take questions at the very end of our whole presentation, but I wish you the very best. Thank you so much for your time and for listening. Goodbye.
Thank you very much, Professor Alma-Ata, for sharing these insightful reflections and experiences, and indeed, really great expertise and use of social media. And yeah, personally, I've seen how social media as a tool has a great potential to really be employed in advocating for different global health issues. And I've seen also some fellow friends, young people who employ social media today to really defend their causes. So thank you for sharing those practices and experiences. And before moving on, of course, make sure to note your questions, because the interactive part is coming very soon, where all the speakers who are here today with us will be answering all your questions, and we will be opening some interesting discussions. I'll be giving the floor to Rinki again to share with you an opportunity for global health advocacy indeed.
Thank you, Saad. I just wanted to touch base. Dr. Martin, Keith Martin, the Executive Director of CUGH, had put in the chat talking about our gun control tracker. So this was actually an initiative that we got to start through TAC because of the mass shootings that happened in Dayton and El Paso a couple years back. And unfortunately, this is a little bit more US based, but there is a gun control tracker on our CUGH website that I will put in the chat soon. And it shows how each of our House and Senate representatives voted on certain gun control measures or anti-violence measures. And we also get opportunities with, it has contact information, so you can contact your representatives to ask them more questions about those specific policies. I also did want to touch on a really quick personal story because of all this advocacy talk that we've been having. Earlier this year, during the rise of the Black Lives Matter movement, we did have a meeting with the mayor of Dayton, which is where I'm from, obviously. And we talked a lot about how racism is a public health crisis, put forward a proposal and got the mayor of Dayton and the city commissioners to declare racism a public health crisis in the city of Dayton and Montgomery County, which is where it was located. That ended up not just being a declaration, but they formed a committee with actual action items to help end racial disparities, especially with public health in the city. So this conversation about advocacy is not just a big picture thing, but it's something that can really improve the lives of the people in your local communities. So I'm really grateful for everyone for taking the time to speak today and talk more about how to do the specifics of it. Saad, back to you.
Great, thank you very much, Rinki, for sharing. So before progressing on, raise of hand, you can either do a reaction or do a virtual hand raise. Who here have already had an experience in global health advocacy? If you did an advocacy, let's say on any specific global health topic. I see some hands being raised, not many. Okay, hopefully after this session, you will get the motivation to start doing some global health advocacy now, especially online with all the tools being shared. Now, the second question, who here is motivated and wants to do some global health advocacy in the future? Raise your hand. So let's see. I see more hands being raised. That's really great. So talking from personal experience, and again, I've been trying to get involved in global health advocacy for the past years as a young trainee. And one of the challenges is that most opportunities that are out there are on a voluntary basis. And doing that with the studies, with the work is not really sustainable. So the next presenter will really share some inspiring reflections about how you can make your global health advocacy sustainable and how you can create, build and plan your global health career. So we will have Dr. Sharon Reedy with us, who is a board certified coach and counselor. She has directed the USAID flagship Global Health Fellowship Program for the past 20 years. She has almost a decade experience working in Anglophone Africa on several internationally funded global health projects. So we will hear an inspiring presentation from her and how you can create as a young person your global health career. So I'll be sharing my screen again.
Hello, everyone. I'm Dr. Sharon Rudy. I'm going to be talking for about 10 to 15 minutes, bringing a career perspective into the conversation about advocacy. I'm going to say a little bit about me, then I'm going to talk about the global health career environment and kind of what it looks like in general right now and what some of the longer term trends are going to be. I want to highlight two key competency clusters that research and our own experience tell us really matter in terms of your success. And then I'm going to circle back and talk about advocacy skills and how they might relate to your professional journey. Obviously, I don't have any PowerPoint. This is just a personal, informal conversation between you and me. So a little bit about myself. I started working at 17, worked my way through 3 graduate degrees. I was chronically underpaid and overworked. Some of you might relate to that. I did not understand how to articulate my value to an organization, nor how to negotiate the kind of professional life that I wanted. Mostly, I was just always very happy to have a job. I didn't get into global health until mid-career, so I had a lot of technical expertise, but I did not understand the business of global health. I didn't understand the context of it. I didn't understand the key role of donors or of projects. And so I had to learn a lot really fast, and I was able to do that. And over the course of the years, I no longer felt that global health was a secret society of which I wasn't a member. And I eventually became project directors, was able to bid on and led a number of projects to the tune of about $750 million. And it's really been my honor over the last 20 years to focus on recruitment and support of global health professionals, from people that were, and I've coached hundreds of people, to those trying to figure out which graduate school to attend, to presidential appointees. I retired from leadership last year as one of the highest paid global health project directors in the USAID system. Now, if discussion of money seems unseemly, then I would just say, get over it. You have to know what your value is. You have to have an honest, humble, authentic assessment of what you bring to an organization. Okay, so enough about that. Let's talk about global health environment and what that's looking like. When I think about careers in global health, there are 3 sort of streams that thread together, but they're important to understand because they reflect different skill sets and they require different experiences and expertise. You can have all 3, and a lot of people do at different points in their career. The first one is direct service provision, and that is, if you're in medical school or nursing school, you're going to get that in spades. The second is research, and that's the creating new knowledge, and that's a whole separate skill set, and you could get some of that in your program, you might not. The third and probably largest area is program work. It's the project work. It's the design, the implementation, and the evaluation of interventions. All 3 of those are important, and if you're in grad school that doesn't offer what you want, what you're looking for, you're going to have to get those skills on the side. Now, in terms of where the jobs are, it's kind of a good news, bad news thing. There are way more academic programs in global health now than there were 10 years ago. And there are more academic programs, either full-on degree programs, but also tracks and certifications, because there's a market for it, because you asked for it. Unfortunately, if you're an American, there are fewer jobs for you overseas. And so you have to negotiate that. You have to figure out what is the collection of skills and experiences that you can speak to and how that makes you stand out from others. I did a study, or I worked with others on a study, and in fact, CUGH was the oversight person on this. We tracked the job hunting activities of 152 MPH MHS graduates for 6 months. Now, 79% of people got jobs or they went back to school. The 84%, there's a couple interesting data points from this study though. 84% of people who got jobs in the US, but only 30% really wanted to work in the US. So just be aware that that first dream job may not be overseas. The second is the salary disconnect. No respondents made more than 100,000. I think the median was between 60 and 80, but there were a not insignificant number of respondents that were expecting around 160. So, okay, reality check. Now of that 21% that after 6 months had still not gotten a job, we interviewed them particularly about what their experience has been. And this is really useful data if you're preparing for your own job hunt. They mostly said that they just couldn't find that right job fit. But the other thing that they noticed, and it was a statistically significant pattern, was that employers were asking them for the proposal development experience and skills, and software, what sort of software they knew, what kind of technology had they mastered. So kind of be aware of that, and that's going to come back around again. And I want to say something in particular to lower, middle, and income country health professionals, LMIC health professionals. It's really important when I look at those LMIC health professionals that have been really successful in global health. There are a couple of things that they have. Well, everybody's smart, by the way. Everybody is technically competent. That's almost never the issue. But LMIC health professionals who are really good at being culture mediators, they understand the culture of the donor, and in often cases it's a high-income country donor or a foundation, and they understand their culture, and they're able to translate between those two cultures. They are very effective, and that's a very high value skill. And the other area I would really recommend emphasis on is communication, language in particular. How does your resume look? How do your cover letters look? How do you write an email? How, the quality of the dominant language that you're working in, you really have to have mastery of that. It matters. Okay, so there are new jobs coming. I just want to say this is a kind of a good news thing. The U.S. in particular is rejoining the global community, and that is very helpful. And there's some evidence of that. For example, there's a big contract that's being planned now for implementation coming out of USAID, the United States Agency for International Development. It's called the Global Health Technical Training Advisory and Support Contract. It's an 8-year contract. They combined all their non-direct hire mechanisms. It's between $700 million and $1 billion that they're going to be putting into recruitment and hiring and professional development. So it's a very big deal, and it really is going to open up a lot of opportunities. Now I want to talk about another way that you're going to be able to enter into this job force, and really passion trumps everything. Like, what is it that matters to you personally? If you are in love with a country or a culture or a technical issue or a target population, you need to follow that, because your passion will shine forward in anything that you present. But there are some global trends to track as well. Specific health areas, pandemic, disease, anything related to infectious disease is going to be very well funded by both governments and private sector. Chronic disease, because chronic disease is a big killer, and it's eventually going to catch up with the funding organizations. Key populations, youth is always going to be important because of how young populations are in developing countries. Climate change and health and blank. Climate change, definitely in all things. We're seeing a lot more earmarks on health and climate change, health and population, as country priorities and funding interests. Another theme to be aware of is monitoring and evaluation, but turbocharged. If you watch Debbie Birx and her White House experience, understanding the power of data analytics and how critical that is, and how important, how fast moving that environment is. as we deal with multiple data streams and how to make sense of that and how to turn all that into a series of recommendations that make sense to the non-health professional. That's never going to go away. That's still going to continue to be an important area where there will be a lot of jobs, and there is now. Another trend that you want to watch is the business skills, proposal development, new business development, funding knowledge, project design, implementation and evaluation. There's pretty much 8 different ways that the business of global health matters, and that the more you understand, the better your prospects are in global health. Technology in all things. But the other thing that I wanted to say, and this was when we interviewed 50 employers, global health employers, we asked them about their hiring preferences. They talked about 2 big deficits that they have to train for themselves in in-service training. One is the business of global health, which again comes up as an issue. But the second is collaboration and communication skills. Understanding multiple specialties and how they impact each other, the ability to foster collaboration among sectors that usually don't work together, the skill in being a team member and in fostering alliances this is a cluster of technical skills that employers are looking for. They feel that they're missing in recent graduates, and they are going to hire you if you have demonstrated evidence of expertise in those kinds of areas. So now I'm going to circle back and talk about advocacy. And of course, there's personal advocacy, that ability to speak for yourself, to advocate for yourself, reality-based self-reflection. There's nothing like a job candidate who can articulate what they love and what they're good at and where their gifts are. The authenticity of that knowledge makes you very attractive to an employer. Now, I've talked about a couple different articles. I want to mention that they're on the CUGH website. They're also on my personal website, drsharonrudy.com, and there's some other tidbits there that might be of interest to you. But I want to finish up by telling you a personal advocacy story. I've been working for Johns Hopkins for a number of years, mostly in Africa, but I found myself in India on a TDY, business trip related to reproductive health. And I was in a taxi in New Delhi with 2 very high-level USAID professionals, the driver and a woman who was kind of our host for the trip. And the host said something to us, started talking to us about family planning, and in her mind, how God is in charge of the size of her family and of her fertility, her desire to have a spiritual position. We, as 3 American women, were completely unprepared to engage with her around her beliefs and her behavior. We had our PowerPoint data. We knew the benefits of modern family planning methods, and we talked in that vein. But our inadequacy, the inadequacy of our response really shook me. I had a lot of time to reflect on that conversation and my failure in that conversation. And I thought a lot about it, and later I had the opportunity to engage with her for additional communication. And I consciously decided to approach the situation differently. I brought it back up, and I led with kind of like an authentic, my own authenticity, my own self-disclosure, and deep, respectful curiosity for who she was as a woman. We subsequently had great conversations about God's hand in all things medical, including family planning methods. That experience changed the way I thought about my work. Shunryu Suzuki famously called this the beginner's mind. I found relief when I discovered the benefits of curiosity and openness. I paid attention with respect and interest, not to manipulate, but to understand what was true. And as he famously stated, quote, "And seeing what is true, the heart becomes free." And with that, I'm going to turn it back to the moderator, and I'll be around for the Q&A. Talk to you later.
Thank you very much, Dr. Sharon, for really the inspiring presentation and for sharing your personal stories. And I'm sure that personally, it did resonate with me. The openness to learn, the continuity of being dedicated to improving yourself and contributing to global health is something we all need. And also for sharing all those open perspectives about how we as young people can you maybe start and plan our future global health advocacy journey. So thank you for sharing that. And I'm sure we'll have a lot of questions from our young presence here. So finally, it is time to move to our final presentation, which will be by Ann Peters, who is the University and Community Outreach Director of the Pulitzer Center. And the Pulitzer Center raises awareness on underrepresented global issues through direct support of quality journalism. So Peters Ann will be talking about storytelling and how it can be used as a tool to leverage and succeed in your advocacy work. So I'll be sharing my screen again.
Hello, and it's very nice to be with all of you today. I'm Ann Peters, University and Community Outreach Director at the Pulitzer Center. And for our time together today, I'm aiming for you to get to know more about the Pulitzer Center, its work, and the journalistic process. By way of my own journalism background, I worked as a wire service reporter, bureau chief, and editor, covering a range of issues in North Carolina, Washington, D.C., the Middle East, and Southern Africa. And from there, it was law school and working then with human rights organizations. I came to the Pulitzer Center in 2007, just a year after it began as a nonprofit journalism and education organization based in Washington, D.C. The past several years, the Pulitzer Center and CUGH have partnered on a number of events, and I hope you'll join us at this year's conference for a conversation on Friday, March 12th, between Boston University Deans Sandro Galea from the School of Public Health and Mariette De Cristina of the College of Communication, along with author Stephen Johnson. They will focus on living longer, living better, a conversation about the marvels of public health and human longevity and what still needs to be done. Boston University is a longtime partner of the Pulitzer Center's Campus Consortium Network. Johnson is one of our grantees, and his latest book is due out in May. It is called Extra Life, A Short History of Living Longer. NPR's Ritu Chatterjee, who also has received support over the years from the Pulitzer Center, is a moderator for this conversation. So the event brings together our mission very nicely. Today's segment is a preview to another conference session on Sunday, March 14th. That workshop is the latest in a series of communications events organized by the Pulitzer Center, Global Health Now, an initiative of Johns Hopkins Bloomberg School of Public Health, another of our partners, and CUGH. Usually we organize more of a hands-on communication workshop when we're all together, in tandem with conversations with journalists. While virtual, we'll aim for the March 14th session to dig more into some of the points I raised with you today. At that session, we'll also be focusing on how to fight disinformation. And you'll hear from Claire Galafaro, a journalist from the Associated Press, who has worked extensively and reported extensively about poverty, politics, in rural America, as well as Tara Kirk-Sell, a senior scholar at Johns Hopkins Center for Health Security, and Claire Wardle, a leading expert on user-generated content verification and misinformation. For our time together today, I'll also be bringing in via the power of video my colleagues on staff at the Pulitzer Center and several of the journalists we have the pleasure to work with. That way you can get to hear from many more different sources about what we do, how journalists create their work, and how you can incorporate journalistic techniques into your work to get the word out regarding underreported stories or to raise up underrepresented voices. I'll take a moment now and we will have a listen in on a short video introducing you a little bit more to the Pulitzer Center.
We have to help journalism survive because civil society can't act if they don't have the facts. The number of deaths per day, the pressure on hospital systems, businesses still not being fully open.
We've had 5+ years of bad things from the dairy industry. This, on top of the COVID, is the test that we've never had to face before.
When my uncle got sick, it went from something that you just hear in the news to somebody so close.
How do you practice social distancing and keep yourself safe when you're in ICE detention?
As this topic is becoming more and more important, we're also seeing a lot of newsrooms shrink.
I've been supported by the Pulitzer Center, and they provide funding to help get stories that haven't been represented very much in the mainstream media.
This was in the middle of a pandemic. Borders were closed. We found journalists already in the countries who had existing networks and contacts and brought them into the project. And you know what? I think that the end result was much stronger.
We have to keep trying to figure out a way to keep these important journalistic enterprises going. Why? Because our democracy depends on it.
We packed our food for 5 days, and with guides we hired, followed the migrants as they set out.
CUGH Africa is changing the story by putting Makoko on the map.
Journalism is the best way of teaching students to consider opposing viewpoints and to create open-minded, curious learners. And that's really my role as an educator.
The Pulitzer Center, they turned journalism into curriculum. It's been their most downloaded curriculum that they have produced.
The 1619 project is for everyone, and the curriculum is for educators and for school age children.
Storytelling on this project would not have been possible if it weren't for the support of the Pulitzer Center.
The story was produced with the support of the Pulitzer Center.
Pulitzer Center on Crisis Reporting.
Thank you for joining me with the rest of my colleagues who produced that report for our 2020 annual report, which is on our website. We are eager for you to look further at the website because A, it's newly redesigned, and B, we think it also provides a lot of resources for you. So take a tour. Under our journalism tab in particular, you can explore many areas that by stories, by projects, stories by professional journalists, by reporting fellows from our campus consortium partners. You can search special initiatives. Collaborative projects are hallmarks of the Pulitzer Center. In March, we challenged our grantees to overcome travel restrictions with collaborations across borders, newsrooms, and disciplines. And we launched the Coronavirus News Collaborative Challenge that yielded powerful, innovative reporting and storytelling on all platforms. Pulitzer Center support, for example, enabled Science magazine to sustain its COVID-19 coverage and expand it with dozens of stories from Africa, India, Latin America, and other regions. You'll also see Connected Coastlines, work involving climate science reporting, and our extensive Rainforest Journalism Fund network of journalists from around the globe. Many of these with an overlay of health considerations. You can also look via issue. And regarding these pieces and exploring these projects are some of the best ways to hone your own journalistic techniques, both as a creator of journalism if you so choose, and also as a potential source. You can also hear firsthand from journalists via our webinars on demand, so please take a listen and have some good reading to go with that. As you can see under the health issue, there are a number of projects and story examples. I just want to scroll through a few of the projects, a few of our more recent stories from some of those projects. And now I just wanted to touch base before we continue onward in terms of the Campus Consortium initiative that I mentioned. We have more than 30 partners from undergraduate to graduate programs, as I mentioned, Boston University, from the public health and journalism side, Johns Hopkins Bloomberg. We also are partners with McGill University through its global health programs, George Washington University, Milken School of Public Health. There are large state schools, HBCUs, journalism departments, and international affairs and regional study programs, and community colleges. We're always open to connecting with more public health programs too. And each year we connect journalists with campuses to focus on their reporting. We also offer each year reporting fellowships. In 2020, we selected with our university partners 40 reporting fellows and 28 postgraduate reporting fellows. And this is a photo from our 2019 gathering. We're aiming, hopefully, for a gathering this year. So here's a photo. You may wonder if these are random images or what message lies with them. I just thought of how we need to feed and water plants, and also, in this case, our ideas, to make them grow, to provide time to reflect upon them, and consider the direction that research, reporting, and storytelling might take us. I also wanted to mention that while today we are focusing on journalism, how to think in these journalistic terms and tell stories, there of course may be times when you are a journalistic source. A few points to remember when you get that call, email, or direct message from a journalist. Someone is reaching out to you because you know you have expertise, you have knowledge on a particular subject matter, or you may be able to recommend someone who does. In return, it is fine for you to ask for more information from the journalist to make sure you understand what they need and what deadline that they might have. So if you need an extra hour or extra time, more than that, to gather your thoughts, you can set a time to circle back with each other. And please do connect back. And don't be upset also if you're not directly quoted. Your information is taken into account by journalists as they gather more information. And as you'll see as we go through our next segment on thinking about underreported stories, story development, and pitching, you will see how the journalists get their ideas before their editors and in front of them, and in fact have to defend why they are going after a story. It is similar to how you might go about pitching op-ed pieces. And one bit of advice that journalists and especially freelancers always give is never give up. So I want to take time to share with you another video from a colleague, several colleagues of mine from the Pulitzer Center. You can find these again under our journalist toolbox.
Hi, I'm Steve Sapienza.
And I'm Nora Moraga-Louie. We're members of the editorial team at the Pulitzer Center.
We're here to talk about underreported they matter and reported for reasons. It usually has to do with our agenda setting.
It's driven by clicks and news cycles around things like disasters and elections. Of course, that doesn't tell the whole story about the world.
These are stories that can save lives. For example, we now know that there was far less coverage of the coronavirus issue in the first weeks of 2020 than we should have had, given what epidemiologists knew at the time. The last time there was a pandemic, in 1918, the same thing happened. The flu claimed millions of lives, but the virus barely made the front page because most news coverage focused on World War I.
Underreported stories raise awareness about issues we know little about. Reading them makes you a smarter citizen, better able to make informed decisions and useful contributions to society.
They also illuminate the deeper issues that we face as a society. They help us build empathy, expose corruption, hold the powerful accountable, find solutions to difficult problems, and affect change. These stories can be about a lot of things. They can investigate inequality and why the gap between rich and poor in our societies is continuing to expand. They could look at the effects of incarceration on families, especially children, or the effects of climate change on the Great Lakes, coastal cities, and beyond.
They can be stories about women's contributions to the well-being of their communities, from the forest defenders in the Amazon to nurses who risk their lives in the Philippines, or nuns on the US-Mexico border who stand up to powerful people and institutions. They are stories that explore important questions. So how do you find these stories?
Notice what kind of stories interest you and determine why that's interesting to you.
Start with the questions that bother you. Do you see things that appear to you unfair or wrong, but that no one is addressing?
Talk to people who have traveled to a place you've never been and ask them what surprised them most. If you hear something that interests you, follow up with your own research.
Visit the website of investigative newsrooms or outlets that focus on specific topics. Can you verify the representation of what is said by Googling other trusted sources?
Is there an individual you've met who is doing amazing work for other people, but whose story has never been told to the broader community?
These are the stories that allow us to see the world in a new light, better understand the issues we face, and make change.
These are underreported stories, and they deserve to be told.
Thank you for listening to Steve and to Nora. They do great work there at our team at the Pulitzer Center. And they mentioned a few types of stories. So I just pulled up a couple of recent ones about individuals. A doctor in the Ciudad Juarez, a woman who's playing a role in development of the vaccine, and of communities, the hurricanes that were devastating a small town in South Carolina and what was left behind in terms of mold and health risks, housing discrimination, other issues related to COVID-19, looking at shared quarters, and also solutions. What are villagers doing in Egypt in terms of building purification stations that they can then continue making sure that they stay in good working order? Or how do grassroots movements help curb noise pollution? So sometimes it's called the secret sauce of story development and pitching. We have to think about the difference between journalism and academic research. Go from ideas broadly to stories about individuals. Consider global, regional, and local issues, or is there a story that overlaps? And in this time, how do we connect with individuals to do reporting remotely and, when possible, in person? As I mentioned, we had one particular postgraduate reporting fellow of that 28 fellows from 2020, and he focused on the stresses among dairy farmers and mental health concerns. He accumulated dozens of hours of interviews from nearly 24 individuals, farmers, individuals who could provide additional background on either the farming industry or mental health issues. He had met over the summer one family that ultimately would become the lead of his story and the main focus. However, they had initially decided not to be part of the story. He had written the piece, in fact, without them, he told me the other day, and thought he was on the way for publication. But by the winter, they decided that they did want to participate. So he reshaped the entire piece and felt it was much better for it. So one other aspect of the secret sauce of the story development and pitching is to be flexible. I want to share with you another colleague's thoughts in terms of her interviewing and reporting process, and to give you another sense. This is from Natasha Alford.
Hi, my name is Natasha S. Alford. I'm a journalist and vice president of digital content at WWII.com. I have always loved storytelling, and as a journalist, I use writing and images to challenge and expand our ideas about people. Many of my stories highlight struggles for justice or celebrate people's achievements in the face of adversity. One very important part of the reporting process is interviewing people. An underreported story I recently wrote about for the WWII, Oprah Magazine, the New York Times, and other publications explored race and identity in Puerto Rico, specifically Afro-Latinx identity. To come up with this idea, I started with my own family and personal story. I'm Afro-Latina, I'm Puerto Rican, and African-American. And growing up, I noticed there was often no mention of Afro-Latinx people in the mainstream media. And there was not much racial diversity in the pictures and stories that I saw in the news. In 2010, the census reported that over 75% of people in Puerto Rico identified as white. That number was not reflective of the racial diversity I knew existed on the island. So I wondered, how do people understand race and identity in Puerto Rico, and how does it impact their lives? In addition, all eyes were on Puerto Rico in the summer of 2019 as protesters on the island successfully ousted their governor over text messages that many saw as sexist, homophobic, and classist. As people talked about revolution on the island, I wondered, would that revolution also take on racism? So I decided to investigate all these questions. Today, I'm going to share some of the interview techniques I use to report my story and some tips that you can use to conduct interviews with people in your own community. Once I've decided who to interview, I always like to do basic research about that person. What can I find out about them with a Google search? Have they done any interviews with other journalists? If I'm interviewing someone who isn't in the public eye, I can still research the topic I'll be asking them about. People really appreciate when you reference details during the interview that show you did your homework. Planning the progression of your questions is very important. Make a game plan of what questions you really want this person to answer. Then think, what do you need to ask them first to get them comfortable enough to answer a certain question? Trust is key. And even if you think you have a connection to a community, you may be perceived as an outsider. So don't take it personally. I like to give people a chance to talk about what's important to them first. For example, I might ask, what do you love about your community? What issues do you care about? After that, I start asking more specific questions. You can always be flexible in the moment and ask follow-up questions, but planning your interview in advance will give you more confidence and help the conversation flow. It's also important to ask open-ended questions, which are questions that someone can't answer simply with a yes or no. For example, instead of asking, Do you identify as Afro-Latino or Afro-Latinx? Try asking, how would you describe your racial identity? Open-ended questions allow your interview subject to explain who they are and why they feel the way they do in their own words. Their answers might surprise you. One person who surprised me during my reporting was a DJ and African drum player named Junior. He had darker skin than mine, and I identify as Black. But when I asked him, how do you racially identify? He said he didn't call himself Afro-Latino or Black. It was really important to him that he be identified as Puerto Rican. The language he used to describe himself met a different set of criteria than the language I used. He did not fit a stereotype, and he helped give my story a more nuanced perspective. That's why we should also never make assumptions about people we interview. Sometimes it's tempting to rush through your questions, but you will get much better responses if you take your time and set your subject at ease. If someone doesn't answer your question right away, wait a few moments before asking again. Sitting in the silence can actually inspire people to speak more. Also, the first thing a person says to you is not necessarily the truest thing. When I first arrived in Puerto Rico, a lot of people told me race wasn't an issue there. But it turned out that many people were saying that because race is somewhat taboo, something they have been taught not to talk about or they may not feel comfortable discussing. When I took my time, asked more questions, and interviewed more people, I found that Black Puerto Ricans are facing issues like police brutality and discrimination at work and school, and many are fighting against it. Asking questions and getting the conversation to open up will allow you to probe for a deeper truth. But doing this takes time. If you ask open-ended questions and take your time, you will have a lot more material that you can publish. How can you decide which quotes you want to use when editing your interview? Well, if someone gives you a ton of facts or statistics, please summarize that in your own words. That's not the quote that you want. Instead, great quotes capture the emotion and humanity of a story. One of my favorite quotes in the story I wrote about racial identity in Puerto Rico for the New York Times came from an interview I conducted with Kimberly Figueroa Calderon, an activist who was campaigning for more people to identify as Black on the 2020 census. Kimberly told me that the devastating effects of Hurricane Maria on Puerto Rico, which is a U.S. territory, and the U.S. government's slow response to send help revealed to some people just how vulnerable Puerto Rico is to the whims of U.S. imperialism. She said, quote, "We are not the citizens we think we are." I thought this quote was really powerful because it showed that for many people, there was a shift in self-perception taking place. These words capture the feeling that drives Kimberly's activism. I chose to report on racial identity in Puerto Rico because of my personal background. Now it's your turn to draw on your identity, to come up with story ideas and interview questions of your own. Ask yourself, what is an issue in my community that's an open secret, something people may know about but deserves further investigation? What issue is being overlooked in a big news story right now? Which people are doing direct work on the issue I'm writing about? Once you have decided who you are going to interview and what you want to talk to them about, remember, start by doing research and planning out the progression of your questions in advance. But of course, stay flexible. Ask open-ended questions that allow your interview subject to describe their own experiences and leave room for their answers to surprise you. Take your time so you can have a more relaxed and open conversation. And listen for quotes that stand out during your interview. Those are the ones you'll want to use in your story and share with others. There are so many underreported stories that need to be told, many in your own backyard. So don't let these stories go underreported. The voices of your community deserve to be heard right now.
And Natasha's documentary from her reporting in Puerto Rico is now out if you are interested. We're at the end of our time together. I just wanted to share additional resources that you can look into on the Pulitzer Center website, resources looking at cultural sensitivity and diversity, safety in the field if you are doing journalistic work and other work in person, advice on pitching, and also other resources, including those related to health reporting. Thank you for your time together, and I look forward to hearing from you all soon. Hello.
Thank you very much for the insightful presentation about the power of storytelling. And indeed, it's an art, the art of storytelling, and how it can be really leveraged and also linked to the social media and other tools we saw earlier to really show some light on the different global health issues that matter to us. So after hearing the presentation and hearing all the speakers, inspiring speakers really that we had today, I invite all speakers to put their cameras on, and as we will open our panel discussion now and open the floor to you all for questions and answers and have some interactions. So I'll just be looking at the chat, and also feel free to raise your hands if you have any questions so that we can, start the discussion and hear more inspiration from our speakers. So I'm seeing Emmanuel raising his hand. Emmanuel, do you have a question? If yes, you can activate your mic. Or was it from the exercise earlier? I guess not. So I'm just monitoring the chat. If anyone has any question, if not, I can maybe start the conversation as we wait for more questions. So we've been really hearing some interesting insights, and here is a question here from Karina.
Yeah,
Karina,
hi. I was just wondering if there are any recommendations or anything along those lines for young professionals to get a bit more involved in global health, especially now that a lot of activities are kind of remote and working at home and whatnot. So if there are any suggestions by the panelists.
Sure. We have many panelists, so if anyone wants to start, you can either raise your hand or go ahead.
Well, the good news is that the recruitment and involvement of professionals in global health has been virtually run for a decade. So employers are programs, organizations are used to putting up positions online, and there are some really great job hunting websites to check out, and I could dig those out and share those through CUGH at a later point. But there's a lot of there's really, I mean, it's kind of business as usual in a lot of ways. I mean, projects are being run, people are gearing up, and so I think that it's a really good time to have your antenna out and searching the web for those specific employment opportunities. Early careers, it's happening.
If I can add to that, a couple of important considerations. I think in many ways we are at an interesting juncture in global health. COVID and George Floyd have been very important flashpoints, and future engagements in global health will demand that we bring a sense of humility to the work that we bring, right? Historically, engagements in global health have not always had that. So my suggestion, along with what Dr. Rudy mentioned, is to look at this as a growth opportunity for every one of us, right? When we go into an engagement, what is it that we are bringing to the table? What baggage do we bring? What skill sets do we bring? And also, what are the things that we can learn from this as we move further in our career in global health? I think that's an interesting way to approach the current situation.
Indeed, those are some very valuable reflections. Thank you very much for sharing. Do we have any other reflections on the floor, or can we move to the next question? Okay, so we have a question from Priscilla coming up saying or asking, how can students contribute to the concept of addressing decolonizing global health from their homes? I think Professor Rosen talked earlier about the concept of decolonizing global health, and indeed it is a very serious issue nowadays. So maybe what role do young people today have, especially as we are talking about taking action from our homes? So feel free to share, all the speakers, if you have anything on that.
Yeah, thank you so much for that question, Priscilla. And I think you ask what role students and trainees have. It's really the entire role. It's your world and your future in this regard to reimagine what global health should be. And I would suggest a lot of people get involved in global health because of deep concern about community, focus on inequities, and working with our neighbors and colleagues across oceans and borders and boundaries. And part of that is wanting to work and live in new settings and experience new ways of thinking and new systems of knowledge. And some of the ways that has been done in the past have been extractive and exploitive. And I've talked in my presentation, but in other settings about medical missions or short-term engagements in global health that have involved practicing without a license, or essentially practicing clinical care without regard to local laws, but more importantly, not without regard to the impact on the local community or the local healthcare setting, and what that means from a deep sense to think that you can travel overseas and do something that you're not allowed to do in your home community, and is it practicing medicine on low resource people, and so as you imagine the future, I think the way to get in that decolonizing mindset is to think, what should be my role in this community? What should be my role in this conversation? And really stepping back and listening and opening and learning from others. And with that approach, I think the future of global health will change. And this pandemic has really taught us, at least in high-income countries, that we do have so much to learn from other settings and other countries and other ways of doing things. And that will enrich global health if we understand we're not exporting our way of doing practicing medicine or practicing whatever profession. We're not here to help, but we're here to learn and here to make the world a better place with a consortium of ideas that that come from different places and different approaches. So I know that's sort of general, but I honestly think that just changing our mindset is going to change the field for better and change medicine for better and change the world for better. And so thank you for asking that question.
Shelley.
Yep. If I can add to what,
yeah.
If I can add to what Dr. Rothon mentioned, there's a saying in our university that if you want anything done here, send a student, they get things done. And we sort of say that tongue in cheek because it's not just the exuberance and the energy, it's also the unburdening of the legacies. What I mean by that is, like Dr. Rothon mentioned, our history in global health has not always been really one of equity. It's been extractive, it's been colonial, and many institutions have been accused of being neo-colonial in their approach. With that said, questioning the status quo is an absolute necessity. And I'd like to second what Dr. Rothon mentioned. We have to stop looking at a deficit-based approach, like, oh, those people have nothing, to more of an asset-based. What is it that we can learn? What is it that we can learn from and with each other? We very well recognize that the problems that we are going to face in global health are so complex that no individual institution, no individual institution or individual country can solve it. We need the participation of everyone. So how can we then set the stage for that? So that is going to be a very critical conversation as we go forward. We've got to stop doing a friend of mine said there are no cowboys, no saints, and no heroes in global health. That should be our approach.
I'm going to add to that. I agree completely with what Shali and Virginia have already said. But I want to make an even stronger statement, because I feel like decolonizing global health is a little bit like dealing with systemic racism. It's so embedded, it's so unconscious, it's so it's multiply reinforced, particularly in the donor community, with self-interest. And it goes to our deepest issues as humans regarding the sharing of power. And I think the only place to start, and you could start right now, today, where you are, is a process of self-reflection. And this, I'm at the point where everything starts with an informed self-observer. So it's kind of where you are, how you think, and you can hear from what Shali and Virginia have said that they've done their work, right? They kind of already work from that kind of open-hearted knowledge, and that's where you want to go. Because if you're going into global health, you're going into a battlefield where a lot of the worst parts of us will be called on. And so the better you're prepared, the better, the more influential you'll be as you sort of move through your career. Over.
And I just wanted to add, oh, sorry, I'm going to very quickly, if I may, agree with everything. I just wanted to stress that I think students and trainees come in with a different perspective. You know, some of it's generational, not always the case, but oftentimes is. And I think that fresh perspective is so necessary for all of us, like in the same way that I get different perspectives when I listen to my patients. And I'm going to be very brief here, but, you know, we're talking about decolonizing our minds. And, you know, I realized in the midst of that conversation that I had, unfortunately, this, I think, you know, internal colonial reaction, because I've had patients who've, let's be honest, suffered over the last 4 years, especially. And with everything that's been happening, you know, recently, I've had more than one family, originally from a country that either they or their parents left as refugees fleeing a civil war, you know, to come for, you know, presumably to a place that was secure and that was safe, who are now actually saying, we are leaving this country. It is not stable for us. It is not safe for my sons to grow up in this country. I don't know how to protect my children. They're literally moving from the United States to Kenya because it's safer there. And so, you know, that perspective, I think, was very eye-opening for me. And so I think students and patients alike just, you know, help us open our eyes even more. And it's a journey. You're always going to be opening your eyes. So.
I echo all the sentiments that were said earlier. I want to commend everyone for being here, because I think that even taking this next step and seeing and learning more about global health and how you contribute in a meaningful way without the colonialism. As a student, that's very mature, and I think it's respectable that everyone is here to learn. And I think we need more people in global health that understand that we're shifting away from a colonial perspective. So it's so important to have everyone here who is doing the right work for the right reasons. I think it might be a little discouraging to hear this, maybe a little bit overwhelming, because, you know, we're hearing like, oh, you don't want to do this and you don't want to do that. And you have to keep all these things in mind. Where do we start, right, as students? It's important that we're moving away from these missions that are just 1 week, 2 weeks, 3 weeks. There are great organizations out there who do more longitudinal work, such as the Fulbright Foundation or Princeton in Asia, Princeton in Africa. And in these contexts, you might not, you know, go over there and do hands-on medical work, but there are other ways to contribute, such as teaching English and really just being there and immersing yourself in the culture for a year and just learning as much as you can, and helping where you can, but knowing where your boundaries are, I think is very important. But it's a great place to start. And also, I think when we were planning this call, we had a whole debate about, you know, global versus local. And is there really a difference between local health and global health? And it should all be the same thing, because, you know, if someone in Nigeria, for instance, wanted to do global health, they wouldn't be, someone brought this up, they wouldn't be doing global health at their local hospital. You know, so to them, the idea of global health is something different. And we want to be inclusive of this idea of global health. So to them, global health might mean going to the United States and working in the United States, right? There's this cross-cultural exchange, but you don't have to go overseas to engage in global health is really what I'm trying to get at. You can work in your local community, and you could also work in like Canada or Mexico or somewhere where you won't have to hop on an airplane. There's lots of ways to get involved, but I think all the speakers really touched up on the key ethics of it and the core ideas that we're moving towards.
Indeed, that's a very valid reflection there. We can do global health in many, many, many ways, and that's one of the beauties of that. And yeah, I'm receiving several questions. So to keep going on with the conversation, I guess one of the questions also is related to our actual situation, saying that what role can students have in the advocacy surrounding the COVID-19 with today's pandemic, for instance, working on vaccine access or equity and our current issues. So maybe applying all what we heard today in our current context. So what or maybe what advices do you give to students? How can they get engaged? Where can they get engaged in? So anyone wanting to share some reflections?
When you say oh yeah, go ahead.
Go ahead. Yeah, it's sort of, you know, applying what we heard about global health advocacy at home in today's problems. So what do you see today's problems, emerging problems, and yeah, what steps or actions for students to take?
I thought the presentations earlier were just completely awesome. I kept taking photos of each of the slides because they were so practical. And to me, they were a guide on how to get your voice out there and influence like immediately. I just thought it was awesome. So I would say start there, do that. But if you're really asking how you get a job in global health, that's a different question. So I'm not sure kind of how to, you know, what's the best way to respond to that. I have a different take. I get in trouble all the time at CUGH around this issue, and it's because I believe that I agree with the definition of global health as I think Copland says it. It's a mindset, and you can have that mindset where you are in this moment right now perfectly. But I also see it as a business because I've been an employer of global health professionals for many years. And I know that there is a certain set of skills and experiences that are required to enter into the business of global health. That it is project driven. It is donor, an overabundance of power of the donors. There's a lot of pieces, moving parts to the business of global health that you really need to insist your academic program is teaching you. And if you can't get it there, you hang out at CUGH and you work with people who are implementing and running projects, and you get it from them. Enough said.
One other point just related to what you all are observing, more from that standpoint from where we come from at the Pulitzer Center. So part of it is you are the eyes and ears of folks. And if you are seeing hiccups in the road or things that are going well, telling that story, there are platforms such as Global Health Now at Johns Hopkins Bloomberg, which is one of our partners. I know they're always looking for public health professionals, journalists, students who have access, who see things, to write up information. You know, there may be more of a curated version of what you might be seeing, and there may be other access points that you can share that information. It is more of that, again, the storytelling to get that kind of skill set out there. So I would say, see what you're seeing. We with our other partner schools, we have with COVID, we have Speaking Out on Coronavirus. So it's a platform that in which folks can, even if it's photography that you might want to share and get that information out there. So it's not from that research side, or not from the, as Sharon was saying, employment, but again, being the observers and getting information out there and conveying it to communities to better inform them as well, or to just open others to what is going on in your communities.
Also, to build off of that, Betty and I worked on a lot of local community engagement projects through the global health advocacy work we did. So one of the best examples is around in 2017, there was a major hepatitis A outbreak that affected a large part of the Santa Cruz County area. And we had a cohort of students from Santa Cruz directly who decided to put on an educational forum at a local library about hepatitis A, and informing the public about what it is, the importance of getting vaccinations against it, because there might have been vaccine hesitancy or anything of that sort. And they had a large number of people attend this free educational forum. So to answer the question of how students can get involved in global health to solve immediate problems, it's really good to look at what's going on in my local community and what can I do to combat, you know, information that may not be available, because I personally wouldn't have thought of using the local library as a venue for something like this. And it proved to be really effective for families who may not have the proper health, you know, understanding that we are very privileged to know as professionals in this field. And especially with the pandemic right now, there's a lot of vaccine hesitancy for different reasons. And there's an abundance of information present at our doorstep, which we may not have paid attention to before, but since this is being brought up in the news constantly, or any platform you go on, there's always COVID information being thrown around, which may seem completely new to people. So I know there's a lot of community projects going on in terms of phone banking individuals who may be less likely to get the vaccine and talking to them one-on-one and that type of personal connection. So there are a lot of community projects going on in which you may have to just do a little bit of searching or asking professionals, you know, do you know anything going on in my community that I can be involved in to combat this local but turned global health crisis. And there are many global health NGOs out there doing a lot of work in these different fields. So just finding something that interests you and you have a personal stake in makes it all the more valuable, and all the more it makes it more fulfilling for yourself too, because you want to make sure that just because it's an issue that everybody's interested in doesn't mean you necessarily have to be involved with it, because it has to be personal for you to a certain extent in order for you to make the greatest impact that you can. So with the Santa Cruz students and realizing how large of a hepatitis A outbreak there was a state of emergency that was declared. They wanted to do something about it within their community, and even changing the minds of a few people in terms of vaccinations for any type of infectious disease impacts so many more individuals that they come in contact with. So that's just a little bit of experience, and as a student who recently graduated from college, and how to get involved in your local communities for global health.
You know, Millie, I can't say enough how right you are on that point. And just a small concrete hint, and I'm sure that Shiley will agree with this. So for the Center for Global Engagement that I work in at University of Maryland, Baltimore, occasionally, well, quite often students will come to us, like, or the Global Health Residence Group or students from our schools, and say, I'm really interested in X. I'd like to help put on a panel on this discussion. And we really respond well when students ask to have a panel and support a panel. And the issues they've come to us recently were menstrual justice, the faith component of vaccine hesitancy, and had panels on these discussions, and also there was one question about a certain population of our international students had a particular concern with vaccine. So we engaged, so one of those students came to our center and asked, how can we reach out to that international student group? So reaching out to your faculty and the people in your school and saying, how can we put on a panel discussion, or can I find a way to help? I think generally in my experience, faculty and administrators respond well to those approaches. And it's a way for you to sort of network. It's a way to get your student colleagues networked, and a way to put some important new voices out there. So that's something I would suggest.
To add to that, I would actually like to bring 3 points in. One, there is a primacy of clinical care that is highlighted significantly in global health. What I mean by that is a lot of people immediately convert what is global health into a clinical encounter. And trust me, I'm trained as a clinician. You got to keep in mind that clinical care contributes at best about 10% of the overall health of a particular community. But we still emphasize that to a point where sometimes we think that's the main way that we should handle all health issues. So keep in mind, there's 90% of the other issues that need to take place, right? So that's one. That holds good in our own neighborhoods. The second point is the ethical frameworks we talk about engaging in global health holds good in our neighborhoods too. I can talk to you about the communities that I've worked in for more than 10 years, complaining of, oh, students come and go, they don't care about us. So the challenge sometimes in the conversations about decolonizing, for example, or global health engagements is, if you go to the extreme, you become an isolationist, as in you don't do anything. That's not the message. Our point about conversations about ethical issues in global health, or decolonizing in global health, is not about saying that don't do anything, because if you do anything, it might be perpetuating something bad. But what is the right way of doing it? In many situations in our neighborhoods, go to organizations that are working in that area, the ones who have the wisdom of the communities. Go to local public health associations, or public health groups, or the state public health groups, and find out what are the areas that, number one, you can learn, and then talk about it being something that you can contribute to, right? So it's a two-part thing. The service learning has to emphasize both. The learning that you get from engaging in communities is a huge, huge, important learning. I think that's the framework. If you use that framework, you'll actually enjoy this, and also hopefully mitigate some of the untoward side effects of it. I'm saying untoward because the one community that I work with here in the Metro Twin Cities complained to me about the 4th student doing the same project in the community. And they were like, why is this happening? Why are they doing the same project in our community and they don't tell us what's going on? that's an important consideration too. So how can you be part of something that is longer in the community, has more trust in the community, and how can you work with community groups that way?
Yeah, a very insightful discussion here, and yeah, some really solid points, starting from finding your passion, finding the right people to work with, and trying to approach them to work with it. And yeah, thank you all for your reflections. So I'm having also a question here from Chris. Unfortunately, his mic isn't working, but he had this issue with getting institutional buy-in to the idea of decolonizing their university programs. Too often I hear, or he hears, what does the university school program get out of this, for example? So before we can even talk about what is ethically appropriate in the community, we are wanting to enter into an agreement with this university. So any tips on how to address these barriers? So mainly the institutional buy-in in general may be a challenge for some students. You know, when you have this passion, but you want to have your institution work and engage, support you. So maybe, I don't know if we have any advices in the panel regarding that.
I can give it a shot, and I know Virginia has some points of view as well. But I think institutions are made up of individuals, right? So who is when you scan an institution or an organization in relation to wanting to change that organization some way, you want to identify who are the potential champions for the change that you're seeking to have happen. And then you have to interact with them at a level of empathy, which helps you identify what their world is like. In other words, you have to give up your intention to change them. And really, and I think you guys early on, I'm looking at the speakers group, you guys early on were talking about this. You have to enter into their world and learn their language and what is important to them. And then you're able to articulate your key messages in ways that resonate with them, that they understand. And I think you can do that. This is a one person at a time process. And it's the only way. My bias is that institutions don't change, but powerful individuals and institutions change. And you can influence them from wherever you are, as long as you're willing to do those steps, which start with letting go of your this rock hard I'm right agenda, you know, and opening yourself up to what their world is like and what their agenda is. They're going to want institutions are always about their own self-interest. That's like a human truth. And so, okay, just accept that. And then what's your strategy for influencing that? Over.
Yeah, you know, I was starting at the point of self-interest is 100% correct. And there, I would say that we're sort of deep in that at my university right now, thinking about how a decolonizing approach to how we can adopt a decolonizing approach, how and why. And it is very much based on individuals, but I'll give you two examples of programs that are not easy, but sort of low-hanging fruit to move forward on this front. One is, and we've learned from COVID, it's reduced the institutional barriers to virtual exchanges. We know we can get on Zoom. We know we can meet on this virtual platform. Old timers aren't scared of it as they used to be. And so one thing I think that is patently improves global health teaching is to have the input of faculty members and students from other places. So there's a formal way to say this. There are these COIL courses, collaborative online international learning courses, where basically faculty members in two different places co-create a syllabus and teach it to their students. And that's universities, that's appealing because you don't have tuition sharing and anything like that. You basically have students from 2 different places in the same virtual classroom learning from a single syllabus. That does not take much training for faculty to embrace. Sometimes they need to make connections with faculty in other places. So we started a small scale with a small honoraria to incentivize faculty to engage in these virtual exchanges by showing sample syllabi, talking about how the strategies to do this, how you fit it into the calendar, how you deal with time zones. So that's just one example of a recommendation of, and it has benefited the university, to answer your question, because suddenly we have more collaborators, more students, more ideas, more people to create joint grant applications. So the benefit was immediate. And a second thing is with our centers, we have a small seed funding program that gives faculty a small bit of money to get some preliminary studies so that they can later apply for grant funding. The requirement around getting that seed funding is that it has to be done in conjunction with another partner, and that all publications or funds have to, moving forward, be joint with a partner in another setting, particularly a low and middle income setting. And just putting that important requirement for the seed funding grant has created so many new joint projects that are really being developed with these 2 sets of eyes, 2 ways of thinking, 2 ways of approaching a problem. So these are sort of, these small programs have had immediate cultural changes and shifts on our campus. And the argument, once you start with these, it's not hard to build an argument for how this approach, this collaborative bilateral approach is so beneficial, so important for the future of global health. So I just wanted to share that, making the argument for decolonization, it does take those individuals and it does take some work, but it's not hard to get started with some creativity.
Virginia, that's beautiful. A couple of added points. A friend of mine said that universities are slow to change. That's a problem with them. And the best point about universities is that they're slow to change. And the reason for that is, yes, it takes time. Trust me, we have worked in large universities. They're like behemoths. But once change occurs, they stay for a long time. So I have been in multiple levels of university administration. I can tell you that there are good people in every level. Their motivation might be different. And this is probably the important part about advocacy, isn't it? Trying to find what is the motivation of the person across you. And you can get into the situation where you should be able to sell the product in a particular way. You never go to a negotiation with a begging bowl. You go and put it across as this is a win for the university. And for me, it's been using some of the tricks that Virginia has taught all of us. Sometimes it's a legal framework that is important. Trust me, you get the legal people in the university involved, they will listen. Risk is a huge problem for universities. Sometimes it's the ethical side. Sometimes it's pushing the idea that we are the first in this field. We should be doing this. Those kinds of things matter a lot in your conversation. And then to add on to what Virginia said, our center also offers seed grants. We have started the evaluations of the seed grant incorporating socially responsible principles. So our evaluation is not just output metrics, but have we done some of these ethical, decolonizing, socially responsible metrics? And we very clearly tell our faculty who apply for it, we are going to be measured by this. And that makes a difference.
Yeah, definitely.
Yeah, thank you all for the reflections. And it is must when it comes to engaging and grabbing the interest or matching the interests of institutions in general. So that is something we should focus on and know how to do. And I guess the more allies we can get around us, the more power we can have and added value we can present to the institution. So indeed, that's something to add. I'm seeing also some questions here. We have some questions from Priscilla. Do you mind taking the floor and asking your question, or I can just read it? Okay, I'll just go through it. So there is a question here about asking for advices on how to support those type of overseas global health programs when it comes to, you know, global overseas programs where you can just maybe donate, or you can get involved as a person, or you can for example, give or contribute with materials, but programs or institutions or networks that allow you as a young person to engage or contribute to overseas global health initiatives. So maybe some reflections or experiences, maybe some personal practices on how to get engaged with such programs when it comes to this type of global health work.
Shiley, do you want to start?
So Saad, is your question, how does one contribute to ethical programs? Is that the question?
I see. Oh, Priscilla, you can go ahead.
Sorry. Yeah. So essentially my question is, I guess it comes to this concept of, you know, sometimes maybe not the best way to help may not actually be going over and being present overseas. Maybe sometimes the best way to help is to find ways to contribute just from where you are. And if you could talk about that, like whether, because I don't know, what is the best resource? Is it always actually your presence? Is that actually even the best resource? Or is it that the organization might just need materials, or maybe they need funds, or so just thinking along those lines, if that makes sense.
Priscilla, you bring up a very, very important question, and I'm going to couch my answer in a few principles. Number one, yes, it's not always important to go abroad. You don't need to do that. You might be saving a lot of money by not doing that. Keep in mind the global health travel industry is humongous, right? So yeah, not contributing to that will be fine. I think that's absolutely fine from a carbon footprint, et cetera, et cetera. Quite often the engagement might mean that you look at what specific skills you have that might be of need to this other person, other group, other entity. And if it is a match, then yes, it might be worth doing. The key, however, is to make sure that there is that, because in many ways, coming from a high-income country, there are some inherent power differentials that are created that might actually lead to a situation where you are either forcing a program, et cetera, et cetera. The part about money is a little more tricky. And the reason I'm bringing this up is there is good evidence behind how money can actually make the need dependency worse. Some of the work done by Noel Sullivan and others in volunteer economies talk about how they create these microeconomies that is so dependent on aid and ongoing funding support that the local generation of ideas, thoughts, resources fall down significantly. So I'm always a little cautious about the premise of just contributing money, because I don't know what that means to the other side, right? Having said that, if there are ways to contribute, understanding who the local organization is, understanding that the partnership is a long-term one, understanding that there are specific skills that are needed, yes, by all means, do so. If not, I would actually encourage people to look around where we live and see, are there ways to get engaged directly in situations where you are more proximal to the issue at hand. Priscilla, does that answer your question?
Yes, that is definitely the answer to my question. Thank you.
Thank you.
Perfect. Thank you for answering that. And yeah, so please, if anyone has any further questions, we still have, I guess, a couple of minutes, maybe another question before we wrap up our session. So I'm looking at the chat, and also you can feel free to activate your mics and ask any questions for the speakers. If not, I have a reflection myself, because since personally I try to get engaged when it comes to global health action, and some of the things that I've seen have been working is now, as we're talking about global health advocacy at home, it's easy to reach out to other young people in other countries from different parts of the world through social media, create those connections, start conversations going, and then start something going on in different countries. Maybe me connecting with friends or people in places where there is a need, and then trying to initiate something. So I see a lot of potential there. That's something that we as young people can start doing and then taking action. So what are some advices regarding that? So once like us young people getting in touch with each other from other countries, what's really the potential that we can harness from it? Maybe do you have any previous experiences with that? Anything to share?
Well, I can say it's a really good question, and with social media now, you can really have positive experiences reaching out to students in your profession in other settings. And in our School of Dentistry, through social media, was able to connect with dental students, different dental student organizations around the world, and they had a summit of sorts on what were issues of concern specific to one location and what were sort of general areas of concern for these students that were international. And one was access to oral health. That was all the dental students from 14 different settings said, you know, our country, including, of course, the United States, has really varying and inequitable access to oral health. And that seemed to be consistent across countries. Another was that the problem that oral health isn't often tied to the rest of, I'm looking at you, Shelly, you're a medical doctor, I'm saying this so poorly, but that there's often a disconnect between oral health and overall physical health. And in a lot of countries that was not well understood, the role of dentists, and wasn't well understood as it relates to human health. So that was an international concern. And just framing those questions in a summit has led to future promises to research together, to write together, to reflect together. And so I think the path you're on is so right to work with these other students. And that is so much more equal, and that puts you on an equal footing with other students rather than this I'm here to help mentality. I mean, I really struggle with this because wanting to help is so important and so embedded in our professions. And I don't want to paralyze that instinct, but it's really worth reflecting on and not helping where you don't have the expertise to help. And a better approach to work with others is, how can I learn with you and from you? And so that's all. That's a lot of words, but I would say that is a more positive approach to global health and will serve you well.
Thank you very much for responding to that. So I will have to cut, but yeah, what I would like to ask in the end from all the speakers is, just imagine yourself maybe getting back in time 20 or 30 years, and then you are a young person. We also have young persons in the panel. Just imagine yourself in the start of the path, and with your current knowledge, and then you are passionate about certain global health issue. How would you start? How would you do that? Maybe that's, you know, sharing concluding remarks, some advices, final advices for our attendees today before we close the session.
So speaking to my younger self, I would say to that person to be braver and to be more trusting of my kind of my desires and my yearning to connect, and to reach out and be curious about the lives of other people, no matter where they live.
Self-trust and consistency. Thank you, Sharon. Courage.
Mm-hmm. And I'll just jump in very briefly. I think that the passions that drive you now, even if you have to temporarily sort of put them on pause as you're going through training, which can be very all-consuming, those are things I think you should always keep nearby and at the front of your mind, because I think that's what will help you get through difficult times, and you never know when that's going to bubble up again in a great way. So never forget those. Don't bury those.
Mm-hmm. Believe in the cause is the must, and people that are needing your help. Yeah. Any other reflections?
One quick point I would tell my younger self is to push the idea of intellectual and cultural humility to the forefront, that understanding that every step of the way you're learning something new, there's a joy in that learning. And the second point from my parting comments would be that this is a beautiful journey. You will make friends, you will get to know people who are not like you, who don't think like you, who don't act like you. There is so much variety, but there is so much fun also. So I'm not in any way in the conversations about ethics or decolonizing or anything like that, suggesting that we become isolationist. I think we just need to celebrate more the significant diversity there is, and that's where the fun begins.
And I'm not from the global health, public health fields, but I think my younger self as a wire service journalist, we are always racing after to get there first. But part of the journalism is also the listening. You know, you want to know, you want to ask, but you also need to listen and see if it takes you in a different direction. So I think that may be one advice to me, to listen better. To my younger self, I'd give me that.
Mm-hmm. Very wise words indeed. Do we have any advices for the younger self from the young speakers?
Well, I wasn't going to say advice to my younger self because I'm still super young, but I think being on this panel was really refreshing to see professionals who have been in the field for so long, so openly show their care for helping younger individuals succeed in this field and find passions that are fulfilling for them. So I think it's just more so a reminder to myself as I move forward in this very long journey to never hesitate to reach out and think that you're inconveniencing somebody just because you're young and you may not have the experience that you think you need at this point. But to just remind yourself that people are there to help you. And if you're excited about something, there's definitely someone out there with the more experience who's willing to guide you, who's just as excited as you are. So that's a piece of advice I'll keep reminding myself in the journey ahead.
I love that. I love that. That's very wise, and it's really powerful to be to show humility and to ask, and support will be there for sure. Thank you for sharing that. So yeah, thank you all for sharing. And any last words? Yeah, Sharon, I see your hand.
I just want to add one thing, and it's that I wish that I had done this earlier, and that is to develop a weekly practice of self-examination regarding what do I love and what am I good at? Where are my gifts? It would have spared me making poor career decisions, and it would have helped me focus on the work that I was meant to do. So if I would just started that earlier, it would have been it would have spared me. So I want to offer that to you guys.
Not a
Thank you very much. Thank you very much, and thank you all really for the wisdom and for being here with us today. I know that 3 hours went too quickly, so before we close, or to close indeed, I thank the speakers again, and I give the floor to Rinki to share the closing remarks.
Yeah, I just wanted to say thank you all to everybody who attended this panel and to all our speakers, everybody who did the recorded sessions. It was amazing, and this live session was better than I could have ever dreamed for a virtual session. So thank you all so much for coming. And then just to wrap up, we do have a session on Saturday, 4:30 to 5:30 p.m. Eastern Time. That's going to be focused on anti-racism and global health education. So this is going to be the perfect setup for us to kind of delve deeper into that topic. It'll be a full hour talking about certain programs, initiatives, and how we can do better from that educational perspective. I will put my email in the chat, and then if you guys have any questions for any of our speakers or anything, let me know and I can connect you with them. That might be a little bit faster than having everybody put their emails in, although you are welcome to do so. Thank you again so much for coming.